When facing a cervical cancer diagnosis, understanding your treatment choices is a powerful step towards regaining control and feeling empowered. It is perfectly natural to have many questions, especially about potential surgical options. Have you ever wondered what exactly cervical cancer surgery might involve? Cervical cancer surgery generally involves removing cancerous tissue from the cervix and sometimes surrounding areas, with the specific procedure depending greatly on the cancer's stage and how much it has spread. The goal is always to completely remove the cancer while preserving as much healthy tissue as possible. The type of surgery recommended is highly personalized and based on several crucial factors. These include the stage of the cancer, the size of the tumor, whether future fertility is desired, and your overall health. For very early-stage cancers, a conization, also known as a cone biopsy, might be performed. This procedure removes a cone-shaped piece of tissue from the cervix containing the abnormal cells, often allowing for future pregnancies. If the cancer is still localized but a bit more advanced, a radical trachelectomy might be an option. This procedure removes the cervix, the upper part of the vagina, and nearby lymph nodes, but it leaves the main part of the uterus intact, potentially preserving fertility. For more advanced or larger cancers, a hysterectomy is often recommended. This involves removing the uterus and cervix. In some cases, a radical hysterectomy may be necessary, which also removes surrounding tissues like the upper vagina and nearby lymph nodes, and sometimes the ovaries and fallopian tubes. Lymph node removal is crucial because it helps doctors determine if the cancer has spread beyond the cervix. Preparing for surgery typically involves various tests to ensure you are healthy enough for the procedure. Your medical team will provide detailed instructions on fasting and medications. Post-surgery, you can expect a recovery period, which varies depending on the specific operation. Pain management will be a priority, and your team will guide you on activity restrictions and follow-up care. Open communication with your doctor and nurses about any concerns you have, before and after surgery, is very important. Many cervical cancer surgeries can now be performed using minimally invasive techniques, such as laparoscopic or robotic surgery. These methods use smaller incisions, which can lead to less pain, a shorter hospital stay, and a quicker recovery compared to traditional open surgery. This advancement is a game changer for many patients. The meticulous removal of lymph nodes during surgery is also a critical step, often determining the cancer's official stage and guiding any further treatments you might need. Ultimately, cervical cancer surgery is a carefully considered and tailored approach designed to effectively treat the cancer while aiming for the best possible outcome for your long-term health and well-being. By understanding the options and discussing them thoroughly with your healthcare team, you empower yourself to make informed decisions about your treatment journey.